As two promising COVID-19 vaccines await FDA approval, Massachusetts-based Moderna is looking for 3,000 children to help them test out their vaccine candidate.
Western Mass News reporter Lindsay Thorpe is getting answers from a local pediatrician about why this is an important step towards getting back in the classroom.
I think the more people who can volunteer, the better, because the more people in that trial, the more valid the results are that tell everyone that this vaccine is safe and effective in this age group.
Dr. John O'Reilly, Chief of Pediatrics with Baystate Health, tells Western Mass News that Moderna here in the Baystate are asking children between the ages of 12 and 17 to participate in the vaccine trial is smart. He says their immune systems are fairly close to those of adults, but the real worry with children this age is with their mental health.
Right now, our middle schoolers and high schools are really suffering, not physically suffering, and they won't be terribly sick from getting COVID as a virus, but they're suffering the effects of social isolation and the impact of no school.
Dr. O'Reilly says clearing children to get the vaccine will not only protect them from the virus, but others they come in contact with as well.
But there is a long-term benefit of protecting your child from moderate to severe disease, chronic COVID long hauling syndrome, and protecting everyone else that your child is in contact with.
And a lot of parents and Western Mass News followers have been sharing their concerns and opinions on our Facebook page with not wanting their child to be used in the early stages of testing and are worried about the side effects of what this vaccine could do.
Side effects, I think we're going to anticipate that an adolescent who gets this vaccine will get some local soreness, will get some muscle aches, will get some fatigue, and may get a little bit of fever. That does not mean they're getting COVID-19.
But making that decision is not always an easy one or the right one, but giving your child the chance to become immune so they can get back to the classroom is what experts like Dr. O'Reilly are hoping for.
And I think you want to look at your child and say, I'm going to balance a small risk of a sore arm, some fatigue, some fever, with the greater risk that my child is suffering on an emotional level with anxiety, depression, anger, sleep problems. And those sort of mental health issues that happen in that 12 to 17 age group can go on to negatively impact them for the rest of their life.
For Western Mass News, I'm Lindsay Thorpe.